Dr. Judy. Today on Pet MD, we'll be discussing lumps and bumps in your dog. I'd like to introduce you to Molly. We have recently rescued her. Molly does have some lumps and bumps. One of her major lumps is this little cyst behind her ear. Now, how do we really know what that is? Whenever you find a lump on your pet, ideally it should be examined. At minimum, a fine needle aspirate should be performed. It's a very simple procedure. There's no sedation or anesthesia required to put a little needle into the tumor. Most veterinary clinics can examine it immediately and tell whether or not that lump is, for example, a benign lipoma. Lipomas are extremely common as dogs age, and you can kind of move them around. They kind of feel gelatinous, almost like a water balloon effect underneath the skin. So when you receive the diagnosis from the veterinarian and they say it's something benign and not to worry, still keep in mind that lumps can change, and it's your responsibility to keep an eye on that lump for any kind of changes. If it enlarges, if it becomes ulcerative, or simply if it bothers your pet. There are three basic types of treatment for a lump or a bump, depending on what the definitive diagnosis is. And these are surgical removal, radiation treatment, or chemotherapy. So our take-home tip today is that not all lumps and bumps are bad. Pay attention feeling for little lumps in some of the common areas. And if you notice something, it's important to get a definitive diagnosis from your veterinarian.